Welcome to today's Explainer. We're diving straight into something totally crucial to men's health, but, it's something nobody really wants to talk about. We're breaking down reproductive medicine specialist Dr. Sunil Jindal's insights on how to understand and reverse erectile dysfunction using real, proven lifestyle changes. Let's decode the science of reclaiming your health together.
Okay, let's dive into this. Look at this statistic from a major 2018 study. An absolutely staggering 1/3 of men silently experience erectile dysfunction. 1 in 3. Think about that. If you're looking around a crowded room, a guy right next to you is probably dealing with this, completely in secret. Dr. Jindal brings this up right out of the gate because we really need to kill the stigma here. It's incredibly common, it makes total medical sense, and most importantly, you're absolutely not alone, and it is highly treatable.
Here is our roadmap for today. 1. The hidden reality of ED. 2. Diet and physical activity. 3. Sleep and weight management. 4. Stress and sex therapy. 5. Alcohol and smoking risks. And 6. The bigger health picture. Let's get right to it.
Section 1. The hidden reality of ED.
So, clinically speaking, erectile dysfunction is defined as the inability to maintain an erection sufficient for sexual intercourse. But, and this is the absolute kicker, it actually functions as a critical indicator of holistic male health. It is not just some isolated mechanical glitch down there. It's literally your body's alarm bell going off.
When you look at the root causes, it becomes super obvious why this is a whole body issue. Right? Aging is in there, sure. But look at the rest of this list. Diabetes, high blood pressure, even the medications you take for high BP or depression. It's linked to spinal cord injuries, severe anxiety, obesity, and heavily tied to smoking and tobacco use. ED is this complex intersection of systemic, physical, and mental factors. Like I said, it's the dashboard warning light for your entire body. Section 2. Diet and physical activity.
The data on diet is, frankly, mind-blowing. On one side, we've got the gold standard, a 2020 study heavily backing the Mediterranean diet. We're talking fruits, legumes, nuts, omega-3 fatty fish, basically your ultimate defense against ED. Another study from 2017 found that for younger guys, 18 to 40, drinking coffee and tea and eating red foods like carrots and tomatoes gives you some awesome protective benefits. But then, on the flip side, our modern fast food diets. Chow mein, heavily processed junk, this stuff literally causes atherosclerosis. It deposits plaque straight into your penile veins, blocking off the exact blood flow you need for an erection. You are, quite literally, eating away your erectile health.
And this brilliantly illustrates exactly why we need movement. The 2018 exercise prescription to fix that poor blood flow is actually super specific. Step 1. Pick an aerobic activity. Running, cycling, swimming, whatever gets the heart rate up. Step 2. You've got to do it for at least 40 minutes a day. And Step 3. Commit to 4 times a week for a full 6 months. Why the strict rules? Because this exact protocol forces your blood vessels to physically open up, it crushes your stress levels, and it naturally spikes your testosterone. And the best part is, the research shows that after those 6 months, it just becomes a permanent, healthy habit.
Section 3. Sleep and weight management.
It is wild how our modern work culture is just actively sabotaging our biology. Dr. Jindal points to this 2017 research paper focusing on call center and IT professionals. The folks working night shifts to match American time zones. That artificial schedule absolutely wrecks their circadian rhythm. Getting a natural 7 hours of sleep balances your hormones and normalizes your blood pressure. But the night shift? It tanks your testosterone, throws your blood pressure out of whack, and massively spikes your risk for diabetes. And guess what? Those are 3 massive, direct causes of ED. Your body literally needs proper sleep to function sexually.
Right alongside sleep is weight management. Now, people kind of assume obesity only causes ED indirectly, like through blood pressure, right? But the data tells a completely different story. Obesity itself is a massive, silent driver here. Take a look at this breakthrough 2014 study on bariatric surgery patients, guys who had surgery for extreme obesity. After they shed the significant weight, they saw massive, highly documented improvements in their erectile dysfunction. So structured weight loss, it's not just about looking better. It is a proven, powerful, natural remedy to restore your sexual function.
Section 4. Stress and sex therapy.
Now, we absolutely cannot ignore the brain because sex is this delicate, incredibly complex interplay between the mind and the body. The mental game is literally half the battle. A 2019 study showed chronic stress is a primary predictor of ED in the general population. When you're constantly stressed out, your testosterone plummets and your sexual desire just evaporates. But hey, there's a concrete fix. A 2021 study proved that psychological interventions, specifically cognitive behavioral therapy or CBT, are incredibly effective at treating psychological ED. Plus, Dr. Jindal reminds us that sex is a partner game. Like, you need a bicycle to cycle, right? You need cooperation here. Couples counseling and sex therapy aren't signs of failure. They are absolutely essential, cooperative, natural remedies.
Section 5. Alcohol and smoking risks.
Dr. Jindal shared this super memorable quote he picked up back in his college days, and it perfectly nails the whole illusion of drinking. Alcohol increases the desire, but decreases the performance. Sure, it might make you feel a bit more confident or eager in the moment, but chemically and physically, it is straight up robbing your body of the ability to actually perform.
21. If you're knocking back more than 21 alcoholic drinks a week, the research shows you are drastically elevating your risk of experiencing erectile dysfunction. The medical advice here is really straightforward. Practice strict moderation or, honestly, total abstinence if you're serious about protecting your erectile health.
And look, while alcohol impairs things, smoking just flat out destroys them. A 2015 study confirmed that smoking permanently damages and closes off the blood vessels in your penis. And it's dose-dependent, meaning the more you smoke, the worse the damage gets. You're basically forcing yourself to choose between a temporary nicotine buzz and functional biology. But there's a silver lining here. If you quit before you turn 50, the data shows you can still yield some truly significant, reversible benefits.
Section 6. The bigger health picture.
So the crucial point is this: 4 times the risk. If a young man presents with erectile dysfunction, his risk of suffering a heart attack within the next 4 years is quadrupled. I really want to let that sink in for a second. The penile arteries are much, much smaller than the coronary arteries. So when plaque starts building up from a bad diet, smoking, or chronic stress, the ED is simply the early warning system. It is literally the canary in the coal mine telling you that your heart is next.
Which brings us to one vital question. Are you just going to try and treat a symptom, or will you take action to protect your whole body health today? ED doesn't have to be a life sentence. It's just your body's ultimate early warning system. If you combine these 7 natural lifestyle changes, cleaning up your diet, committing to aerobic exercise, getting restorative sleep, managing your weight, going to therapy, and ditching the toxic habits, along with a proper medical consultation, you absolutely have the power to reverse this. So what habit are you going to change first? Thanks for tuning in to this explainer, and I'll catch you next time.